50% of adults have admitted they've skipped routine preventative care. And what that does is that delayed care leads to costlier services down the road and sicker patients. And the reason why they're skipping care in many instances is just affordability.
Hey gang, it's Tuesday, February 8th. Rajiv and listeners, welcome to the Behind the Numbers Daily, an eMarketer podcast made possible by Mountain. I'm Marcus, and today I'm joined by one of our digital health analysts, is Rajiv Leventhal.
Hey Marcus, how are you? Glad to be here.
Hey chap, I'm good. Happy to have you. How are you?
Doing well.
Fantastic. Good things. Today's fact, today's myth. I keep saying fact. I've got a lot of myths. I'm on a bit of a myth binge. So that's probably what's going to happen for the rest of the month. But today's myth, chameleons change color or change colors to blend in with their surroundings. It's not true, apparently. It works out that they do blend in with their surroundings, but that's not why they're changing colors. They actually are, according to Wired, chameleons change colors to regulate their temperatures, to attract mates, to communicate with other chameleons, or tell intruders to stay away, not to camouflage themselves. It can't be a complete coincidence that they just blend in perfectly with the background, can it?
I'm shocked. I thought that was a fact, and you're just spreading wealth to the world, because I think everybody would have thought that was a fact.
I've got to stop with these. It's completely ruining me and everything that I thought was right in the world. All right, anyway, let's move on before I lose it. Today's real topic, healthcare consumerism. All right, so talking about healthcare consumerism, we should probably start with what that even means. Rajiv, you mentioned that consumerism is a buzzword in general, but it's now a buzzword in the healthcare space. What does it really mean, and what kind of impact does it, or is it going to have, or has it had on the industry?
Yeah, I mean, across all industries, the customer experience is a business obsession, right? But in healthcare, not really. Historically, healthcare has been a very paternalistic industry, which kind of makes sense, right? Doctors are the experts. They tell you what's wrong with you and what you should do to get better. But healthcare needs to go from a reactive industry to a proactive one. And with that comes empowered patients. If you can empower consumers, they're going to be much more likely to be engaged in their care. They're going to be healthier. They're going to make smarter preventative decisions. And rather than that authoritarian relationship with their providers, they're going to be more engaged in sort of a collaborative relationship with their doctors. And that's really important, because you're never going to bring the cost of care down or become a healthier society unless more people are empowered.
And what's the number one driver for this shift? Is it that Amazon is focused or obsessed about the customer for so long, and now customers have come to expect that? Is it more so that there is one or two particular players that are making the customer feel extra special and the industry is having to react? I mean, I'm sure it's a combination of things, but is there one thing more so than others?
Yeah, there's one or two big ones. I mean, you nailed it. The Amazons of the world are driving this, right? So day-to-day life for me, for you, for most people, it's increasingly becoming simpler and more efficient, more automated, more digitized. Marcus, when's the last time you've called a travel agent to book a flight, or couldn't conduct a simple banking transaction online? It's probably been a long time.
Yeah. And
healthcare is its own unique and complex beast, but people are starting to ask themselves, if everything else in my life is so quick and so efficient and so digitized, shouldn't paying bills and making appointments and even getting care be a little bit easier? So, that's driving it. And then also the pandemic is driving it a little bit too. Of course, very few people, 8 or 9%, were using telehealth, even one time before COVID. Of course, the pandemic created this urgency where you had to get care virtually in many instances. And for the most part, across the board, people are really satisfied. The data shows that if you've used telehealth during the pandemic, you're very, very likely going to use it again, and in some cases more often than you were before. So that is a driver as well, that people are not as skeptical with getting care virtually than they used to be.
Mm-hmm. Right. Pandemic sparked those new behaviors and it looks like they're sticking around. You also had, because you've just put out a report on this, and there was some research about how the pandemic has heightened consumers' anxiety about their finances as well. And two data points that jumped out to me: 8 out of 10 Americans who lost their health insurance when they were laid off still uninsured, 8 out of 10. And then 7 out of 10 families with kids saying that the COVID-19 crisis has affected their income either a lot or somewhat. So it's one thing to say, the pandemic has affected the way people think about consumerism, but it's affected it in so many different ways, whether it's coverage, whether it's using new tools like telehealth, whether it's personal finances, etc.
Yeah, I mean, people's wallets are just tighter than they were 2 years ago. It's that simple. And that's not even healthcare specific. It's just in general. So then when you bring it into healthcare, it's like you said, the unemployment rate hit 15% in 2020. Of course, it's stabilized significantly since then, but people are still without health insurance. And what that means is that you're skipping routine care. There's data in this report that showed, I think 50% of adults have admitted they've skipped routine preventative care, dental services, other services at least one time. And what that does is that delayed care leads to costlier services down the road and sicker patients. And the reason why they're skipping care in many instances is just affordability. I think 3 in 10 adults said that they have not paid for a prescription over the last year as they normally would have because of cost. And that's just a big problem. If people aren't paying for services or for medications, I mean, you can imagine the detrimental impact that could have.
Yes. Skipping care, as you said, putting off payments, which then delays the providers from getting paid. You note that US hospitals lost an estimated $54 billion in net income in 2021, even considering CARES funding. So it seems like a lot of healthcare providers are saying we need new ways to make money. And in doing that, we're going to have to go to the customer. We're going to have to go into their living rooms.
Yeah, it's a business, Marcus. If healthcare is really no different, we might think of it differently, but it's not. If patients aren't coming in, those are services not being provided by doctors and less money. Hospital operations, $54 billion, even with federal funding, $54 billion in losses. So it will rebound, but then you see this Omicron surge again that's again causing providers to delay elective procedures. Again, people have trepidation of going in. Am I going to catch the coronavirus while sitting in a waiting room, sitting in an emergency room, sitting in an urgent care center? These are real problems that providers need to address. Otherwise, they're going to lose more money.
Mm-hmm. What are the key elements or pillars, if you will, of healthcare consumerism?
Yeah, so for my report, I bucketed into sort of 3 categories. Convenience is a big one, and this can mean different things to many different people. It could mean that, I want to be able to easily communicate with my providers. I want to easily make appointments, things like that. But a key driver of convenience is location, right? I want to be able to access care easily and close by to me in my neighborhood and without waiting 2 or 3 weeks for an appointment. So that has done is kind of boosted the usage of retail clinics. So your CVS Healths and your Walgreens, they've administered tens of millions of tests and vaccines, right? So people go into there and they get their vaccines and they've gotten their tests there, their COVID tests. They might be more willing to go the next time to solve like a low acuity healthcare issue, something like that, a throat culture, whatever. So retail clinic usage has increased significantly. We're expecting it to continue to increase over the next couple of years. They offer after-hour availability and weekend appointments. So convenience is a big one. Transparency is another one. We talked about cost. Well, imagine, you're buying a car or you're buying furniture and you don't know what it's going to cost. You randomly pick it up, and then 3 weeks later you get a bill, and it's 3 times more than what you expected. No, that would never work, right? And that healthcare should be the same. Like, I want to know my out-of-pocket costs before I walk into a physician's office. It's that simple, but often that is not the case, and people get plagued with expensive bills down the road.
You say often, your report says 7 out of 10 folks unaware how much a treatment or visit costs until months later.
Yeah.
So most people have no idea what they're going to get billed until many months later, which is insane. Yeah. And then it matters to people. You also note transparency into estimated out-of-pocket costs ranks as a top factor impacting where consumers will seek care. So it's not an afterthought here. It's up there in terms of priorities.
It is. And some providers, innovative ones, will put on their website, put in your insurance information, put in your deductible, because of course everyone's is going to vary, and then put in the service that you want, and here's what's going to cost. And even if we can't give you a 100% guarantee, at least you won't be hit with some crazy surprise bill down the road. One quick anecdote, I read a story, it went viral a couple of days ago. There was a woman in Colorado where she did a virtual Zoom appointment for her son about if the son needed speech therapy, and it was an hour or two session. She got billed a couple days later for like $500 or $600, and she thought that was excessive, but she paid it. And then 2 weeks later, she got billed for another $800 on top, with the itemized reason being that it was a facility fee. And she goes, "What the heck, a facility fee? I didn't go anywhere. I did it over Zoom." So that's the thing. It's these surprise bills are coming. They're really expensive. Most people can't afford them. And it's, people are getting frustrated with it. They're like, I want to know what I'm paying before. And they have every right to do so, just like they do in other walks of life.
Yeah. It seems like there is a lot on the average healthcare consumer's mind. But what does the 2022 healthcare consumer care about the most?
Yeah, well, they care about these things that we're talking about: convenient locations, being able to, search and schedule appointments online, not have to, call places and be put on hold and maybe not even get through it all. Then they care about personalization. That's another big one. Patients continuously say that they want their providers to be compassionate and empathetic towards them. They want them to really listen to them and tailor the communication specifically for them. People want to go home from a doctor's visit and be able to, they have a follow-up they didn't think about, when they were there. And they want to be able to text or email them a question or a concern and get a timely response. So that empathy and personalization that pillar is an important one that I think people take for granted. They say, oh, all doctors are compassionate and have great bedside manner. But that's not really true.
Right. Well, this one surprised me. It didn't surprise me because of people's choice. Because for me, I feel like going to the doctor, half the battle is, are they friendly? Are they a kind person? Are they really listening to what you have to say? Are they going to tell you everything's all right and calm you down? And then obviously, be a smart person and give the correct treatment. But a lot of the reason people go in, at least, speak for myself, is because you want a reassuring voice.
Yeah.
And so that makes sense. In this survey that you've got from Patient Pop from June of last summer, what do US adults want most from a healthcare provider? A good listener, way out in front, number one. Then a short wait was in second place. And then right behind that was a welcoming staff. And it got me thinking, well, with telehealth, it just seems to remove a whole bunch of the kind of the personal communication element. And so it seems a bit contradictory that people want to stay indoors. And I understand there's a pandemic going on, but even as the pandemic fades, I imagine people are going to still use telehealth services, but they still want that personal touch, which is much harder to get through the computer.
Yeah, you're right. I mean, technology in general removes a lot of that face-to-face personal touch, right? So it sort of offsets each other. I mean, I think that, and one that brings up a key point though, people do want telehealth, of course, but they're going to want that to be a hybrid of in-person care as well, because there's just, of course, some conditions and some issues that just cannot be treated virtually. So when you do go into the office, it is important to have some of that personal touch. And then some personalization does apply to telehealth as well. Like what I mentioned before, being able to have a dedicated care team that is prompt with follow-up, that will email you and text you. And if you have a question a couple days later, you can just reach out to them quickly and they'll respond, because healthcare can be scary. It can be scary if you're sick and you can't wait days for an answer or to make another appointment. So being able to have that personal touch is key.
What's the level of urgency for incumbents to respond to this healthcare consumerism trend?
Yeah, so, a lot of what we're talking about is our capabilities that providers, your incumbent providers, your established players don't really have. And that's why it's opened the door for disruptors, as we call them, to sort of penetrate the healthcare market even more. You have your retail companies like CVS, who can be considered a disruptor. But then you have like innovative tech companies as well, and they exist all over that are coming in and sort of stealing patients from your incumbents. And if providers don't improve their digital capabilities, if they don't make navigation easier, if they aren't transparent about pricing and other things, and if the process continues to be cumbersome and burdensome and complex for patients, they're going to go elsewhere. All of these, virtual providers are now offering direct to consumer, visits for cheap prices. And that's going to become increasingly appealing for people if their, clinic down the street is not catching up in, implementing these customer centric and tech focused strategies like some of these disruptors are. And, you mentioned the $54 billion. If providers want that number to go down, they have to re-engage patients back into the system.
The number that jumped out to me the most was that more than half of consumers would prefer waiting at the DMV, the Department for Motor Vehicles, or going to jury duty than dealing with a health insurance issue. I think that speaks volumes. Really quickly, when you're thinking about healthcare consumerism, the same way when you think about shopping online, Amazon just pops into your head. Or you're thinking about digital video, Netflix is right there. Is there a certain company that you think is just doing things really, really well when you think of healthcare consumerism?
It kind of depends on if you're talking about care delivery or, just being able to have like a digital presence. I kind of continue to go back to some of these retail health players. They're not going away. And in fact, their online presence and their ease of accessibility are just going to drive increased consumer usage going forward. Because, you can go on the CVS Health app and schedule an appointment that likely will be available in the next day or two. In some rural areas of the country, I know we've talked about this, it could be a 3-week wait to see a primary care or family physician. I mean, are you kidding me? So people don't want to put up with that. And some of these, retail clinics are understanding that and sort of creating a customer experience that's pretty attractive.
Finally, what strategies can providers and payers deploy to meet consumers' new needs?
Well, they can just become more digitally focused, as we said. There was a survey that I had in my report that it ranked providers' digital capabilities, incumbent providers for some of these disruptors like CVS and Amazon and Walmart and even like a United, which is, keeps buying up different companies. And the lowest scoring disruptor ranked way higher than the highest scoring provider, incumbent provider in terms of their digital capabilities, which shows you there's a lot of ground to be made up. So just becoming easier to access, to enter that digital front door into your system is a big one. You need to improve your technology to improve access. And, other things are you have to be transparent. You have to at least, healthcare pricing is really complex. I make the joke about buying the car or buying the couch, but of course, healthcare is its own unique beast, right? So at least try to become a little bit more transparent, tell patients what they're going to pay and not, hit them with these surprise bills down the road. And then, address patients' social needs. The pandemic has shown that it's led to an increase in terms of lack of food securities in households. People are losing their jobs more. So providers it's not just about like the clinical care, right? Providers can, be more empathetic about what a patient is dealing with, what hardships they're dealing with in their day-to-day life, and then address that. And, they'll be able to win over loyalty and trust more than they previously were.
Yeah, that's a great point. That's it for the lead. It's time now for the halftime report. Rajiv, if you could give us one takeaway from the first half.
Yeah, the takeaway is that you have these retail companies and other disruptors that are leveraging digital technology to improve the customer experience, and incumbents have lots of ground to make up. One silver lining I will say for providers is that given their amount of expertise in this field for conventional players, they're still well positioned to keep folks in their networks. Most consumers trust the conventional provider more than they trust a retail clinic, at least as of today. So they just need to become more digitally focused and consumer centric, and they will be able to retain patients and keep them in their system.
All right, time now for In Other News. First, a quick word from our sponsor, Mountain. What if launching a streaming TV ad campaign was as easy as posting on social media? With Mountain, it is. Their marketing software solution offers an easy way to buy, manage, and measure connected TV campaigns. Ads are served exclusively on premium streaming networks and apps and optimized by automated media buying technology to ensure ads are served to the right viewer at the right time to prompt website visits and conversions. Visit mountain.com to learn more. Right, folks, we are back. Today in other news, digital health funding spikes and why companies are investing in home healthcare. Story 1. Digital health funding jumps to new high as investors bet big on mental health startups, writes Nick Paul Taylor of MedTech Dive. He points out that digital health startups pulled in a record-breaking $57 billion in funding in 2021, up nearly 80%, 80 from 2020, according to CB Insights. But Rajiv, the most important takeaway, in your opinion, from the spike in digital health funding is blank.
Healthcare is an antiquated and inefficient industry, and investors are jumping on the opportunity. We're not expecting this funding to slow down anytime soon. You mentioned more VC funding in digital health companies last year than any previous year. That record was shattered by July, by the way. Mental health startups continue to see huge funding hauls, which really makes a lot of sense given the increased need for mental health services. And it's just a natural fit with virtual delivery. So this is a trend that's going to continue.
Story 2. Mayo Clinic and Kaiser Permanente are once again investing in Medically Home, a company that provides healthcare for acute care patients in their own homes, reports Anuja Vaidya of M Health Intelligence. Medically Home is a Boston-based company operating acute care at home programs through a technology platform and services where clinicians provide care for a range of medical conditions in a patient's home. Rajiv, the most important development, in your opinion, in home healthcare is blank.
That providers are just becoming much more bullish with in-home care. Now, care at home is a pretty immature and early market still. But when you see providers like Kaiser Permanente and Mayo Clinic, massive players, becoming participants and investing in companies that power the technology to allow for the delivery of at-home care, you have to take notice. It shows that if providers can get reimbursed from payers and the government for making at-home visits, they're going to make more investments like the one that you just mentioned. So it's still pretty early. Most patients are not getting care at home or have not gotten it, but they are going to become more familiar with it as long as that payment model continues to trend in direction of reimbursing providers for delivering at-home care.
Is it fair to say that most home healthcare patients are going to be older folks?
Yeah.
Obviously not exclusively, but mainly older folks.
And that's the main target. It's a great point, Marcus, because I saw one recent analysis that we could reduce the total cost of care for Medicare patients, which of course is the older population, by 25%, which amounts to $200 or $300 billion by moving all sorts of care services to the home. So
wow.
That is the key target for sure.
Yeah. So when I was thinking about this, I thought to myself, okay, well, how many older folks are there? In 2019, there were 54 million Americans aged over 65. That's 16% of the population, but it is growing. That share of older Americans expected to go from 16% to 22% by just 2040, according to the Administration for Community Living.
And people are living longer too, so
yep.
That's adding to the numbers as well.
Yeah, great point. That is all we got time for, unfortunately. Rajiv, thank you so much for hanging out today.
Yeah, thanks for having me as always.
Of course. Thank you to Victoria. She edits the show. And thanks to everyone listening. Tune in tomorrow for the Behind the Numbers Brand Anatomy, the eMarketer podcast made possible by Mountain, where our very own Jeremy Goldman will be talking to Matt Alexander, who is the CEO of Neighborhood Goods, a new kind of department store.